Yeah. All right. How are we, Guru? Yeah. Okay. Well, the other day we were talking about why Vero Beach is the greatest spot for avoiding hurricanes, and it was the Gulf Stream, according to the Guru here. Is that correct still?
As far as I know.
And also, this podcast is regarding surgical smoke. For we're going to do awareness of surgical smoke risks and assessment of safety practices during electrosurgery among U.S. dermatology residents. They've asked the residents, do you wear a surgical mask during electrosurgery? And they said 19% said always, 28% often, 88% said sometimes, 18% said never. Okay, this is a bifurcator. Okay, so it's a surgical mask, but it's also there's different grades of surgical masks. And the next question is, do you wear a high filtration mask, an N95, during electrosurgery? They said 1% said always, 1% said often, 16% said, 10% said sometimes, and then 88.2% said never. 88%. Okay, so basically a surgical mask is usually worn during surgery, but in dermatology, it's a lot of office procedures, and people just, folks just don't even wear them, because they're coming in and out of, they're going in and out of different rooms, and they don't feel like it's necessary. Well, now they're starting to figure out it might be not to protect the patient, but actually to protect the dermatologist. They asked the residents, did you ever receive education on hazards of electrosurgery smoke from your program? And 28% said yes, and 71.1% said no. And this is a Journal of American Medical Association dermatology and study. And they said, is there an evacuation system available in all the rooms where electrosurgery is performed? 27% said yes, and unfortunately, 27% said no, and then 45% said I don't know. The reason they say I don't know is because they don't even know what a smoke evacuation system is. Is there a high efficiency particulate air filter in all the rooms where electrosurgery is performed? 2% said yes, 14% said no, and then 83.7% said I don't know. The next question, are you concerned about transmission of infectious diseases via surgical smoke? Well, when you ask that question, 76% said yes. After they were asked these previous questions, they start to think about it, and they go, yeah, that I am concerned, And then 23% said no. The next question, are you concerned that carcinogens are present in surgical smoke? Well, they said 71% said yes, and then 28% said no. The next question, are you concerned that surgical smoke may cause adverse pulmonary effects in the long term? 68% said yes, and 32% said no. Do you feel like adequate precautions are being taken to protect you from surgical smoke? The dermatology residents said 26% said yes, and then 73.2% said no. They're not. The precautions are not being taken to protect them currently. And quite frankly, surgical smoke contains toxic organic compounds and carcinogens and can transmit live viruses such as human papillomavirus. Therefore, prevention of smoke inhalation should be a health consideration for dermatologists. First, the smoke evacuation system is highly recommended. Our study, this particular study that I'm doing a case study, if you don't know, there's tons of papers on surgical smoke, and I figured, well, why not do maybe a paper per podcast episode, and it'll help bring awareness to this issue. High filtration N95 surgical masks are recommended to prevent inhalation of most particulate matter. Okay. Half of the residents, the dermatology residents, didn't even know that smoke evacuation systems were available. A lot of doctors don't know about this. They found that practicing physicians are actually 20 years behind the current research. Most dermatology residents denied wearing these masks. Notably, the cost of both N95 grade masks and smoke evacuation systems are obstacles to promoting surgical smoke. So unfortunately, it does cost money to protect yourself. It's like a firefighter. The ways that the firefighter protects himself costs money. The masks. Could you turn this off, please? Thank you. Anyway, our study demonstrates a significant disconnect between awareness of surgical smoke hazards and clear lack of protective measures. These data can serve as a foundation to help inform safety guidelines in electrosurgery. Ensuring the availability of smoke management devices and N95 masks and requiring formal dermatology resident education on the hazards of surgical smoke and recommended protective measures. So this was a research letter, and it's from May 2017 of JAMA Dermatology, Volume 153, Number 5. And thank you, and if you can hit the red button for me, Guru.